Okay, guys, so I'm going to
Should be.
start. We've got 32 people. That's more than I thought we would get at this stage. And if more people come in, that's fine. They can join us. So welcome everybody to the second Zoom meeting for the Slough Community Champions. We've got, this morning, we've got Dr. Vinita Dutta, who's the Programme Manager at Public Health in Slough, who will guide us through, all right, the confusion, which is what should we be doing under the current scenario that Slough finds itself in. I'm certainly confused. I don't know what to do half the time, and to get clarity is really important. Then we have to make sure that other people get informed about what to do on that one. If you've been to the last meeting, you'll know that the style is that you've got two presenters. One is me, Ramesh Kuka from Slough CVS, and also Tim House, Senior Programme Officer from Public Health. And the two of us kind of facilitate the meetings, and we will call in the experts based on what information that you want from us on a regular basis at these Zoom meetings to answer your questions. So let's, next slide. Should just come up. James, can you put it on the next slide? Yeah, so the protocol is that to let you know the meeting is being recorded, which means if you don't want to be recorded, then what you can do is turn your camera off. That's just to let you know that that's happening for everybody. And to mute your microphone while the talk is happening. Feel free to ask questions, and the way to ask questions is in the chat line. And I've got one thing already in there, which is from Sarah to say good morning to everyone. You can communicate through that one. Me and Tim will pick up some of those questions and then get our expert speaker to give you some answers. The other thing is to enjoy and have fun while you're here. Next slide. So we've got a packed meeting, so I'm going to go through it. Mainly, we'll give you some updates from what happened from the last meeting that we had. And we've got Dr. Vinita for the tier 2 high messages. What does that mean to us? What are the new rules? And we need to make sure that we're reinforcing the key messages. You'll get an insight into the dashboard that exists, and you can keep a track of information yourself on what's happening. And we'll have a Q&A at the end. Next slide. Very quickly, all right, in the background, for those people that not aware, I know some of you are already involved in charities and delivering services, but this is what some of the local charities have been doing. Some of them send us information, not all of them do, so these statistics are far less than what the community response in Slough is, but up to about 1,500 people, 1,500 people are being helped last month in September. We had over 1,200 food parcels being delivered. We got a range of volunteers and charities picking up prescriptions. You'll notice that they're doing it for elderly people, with more than 470 people that are over 70. We've got a lot of people that are being supported with physical and learning disabilities, and people with families and children where people might be vulnerable. Slough is having a powerful response from the charities and the community champions to make sure that our residents are well protected. That's just to give you a glimpse. Next slide, please. So I want to thank everybody for all the support that they're doing, the charities and the community champions and people like yourself. So one thing I want to emphasize is, why are you really, really important? All right, as we go through and you get the key messages that are coming out, why are you important? Two reasons. One, you need to take these messages to yourself and apply them for safety, for COVID-19. And two, you need to communicate that out to other people. Now, an interesting fact, I'll give you a statistic, is that people who've got animals, let's say you've got a dog, if the vet tells you, all right, your dog needs this medication, you will 100% of people will make sure that dog gets the right medication at the right time for food. But when a doctor tells you you need medication, all right, to recover, 20% of people don't even pick up the prescription. And sometimes with longer term conditions, half the people don't use the prescriptions effectively. So there is a powerful human force, which in the voluntary sector, some of it I love, which is that you will do amazing things to protect other people, your family, your friends, and your community. You won't do as much as protect yourself. So the community champions there are to take the message for themselves, but very importantly, to protect the community around them, your friends and your family. So please take these messages out and cascade them to the people that you love and to your neighborhood. Next slide, please. So we're going to do a little poll just to start off with so that you can get involved. And we got, I believe, 3 questions. And you can use your mouse just to click it. The first one is, if a vaccine for COVID-19 were available, would you take it? Yes, no, maybe. Just click on that one that you think is correct or that you'll do. Have you had your flu jab this year? Yes, I have. No, I haven't. No, not yet, but I'm planning to. And the third question, how has COVID impacted you? And you can click as many as you like. So very early on, I didn't sleep very well, so I'd click that one. Certainly the anxiety level increased a little bit. Was I overeating or was I undereating? Over-exercising or under-exercising? Well, I can tell you I was under-exercising because I spent more time at my phone and my computer than anything else. Did you increase your alcohol use? Decrease it? None of the above, or prefer not to answer? And as you click these, we will be able to give you an answer. So James will let us know when people have clicked on.
24 of 34 responses so far, Ramesh.
Okay, well, let's go with that one because we've got 36, but if anybody wants to, now's the time to do it.
Yeah, we're up to 29 of 34, so
Ooh,
almost.
Just 5 people left. Oh, is it me that hasn't done it? Yes, sorry.
Oh, it could be me as well. Oh.
Yeah. All right, let's just do the answer to that, sorry.
So I will end polling now.
And the answers are, James,
share.
take it away.
Oh, I'll share. There you go.
If a vaccine for COVID-19 was available, would you take it? Yes. Now, public health, are you delighted at that answer? I'm assuming you are. We need to figure out what we can do with some of the others around no. All right. Have you had a flu jab? More than half. That's really, really impressive, really, given how difficult it's been to get a flu jab sometimes. I've had a flu jab, which is great. And 24% are planning to, which is brilliant. How has COVID impacted you? Now, the highest one there, all right, everybody can see is anxiety. And that is pretty much the information that I've been getting back from community leaders and from the charities, that anxiety has gone up. And I think I'll talk to Tim later on and Vanita to see what services we might be able to promote to everybody to make sure that is alleviated in some way. People are overeating more than undereating, under-exercising, and so what we need to do is we're going to use this information to perhaps come back with more resources for you that will help you to understand how to exercise during COVID-19, how to alleviate anxiety, and perhaps some of the other things that are coming out. Thank you very much. Next slide. So I'm going to pass over to Vanita now. So Vanita, if you will take over, all right, and if you want the slides to go move forward, just say next. Tom, we'll do that.
Right. Thank you so much, Ramesh. It's a real pleasure to be with all the community champions. This program is quite near to my heart because my first job in public health started working for UNICEF and training the community champions. So it's done a big circle after 20 years that I'm sat with community champions again. So I think pretty much what First, introducing myself, I'm Dr. Vanita Datta. I'm the Program Manager for Public Health in Slough. I've been working in Slough for the past couple of years. Prior to that, I used to work for East Berkshire CCG. So they are not new to me, but I have changed the employer, but still community at really very heart of what we do. I think really touching on Ramesh's point on why you're important as community champions, one of the key things that the evidence change, particularly in certain communities, is more likely to happen when somebody from within the community or within that area where or somebody who they know tells them, gives them a message. So it's about reinforcing, reiterating, but also using you as really being as the champions of the community and the representative of the communities to be pushing these messages out, and an opportunity for us in public health, local authority, and in health to be linking with the community through you. So really important, and I thank you all for being that link. And I know the time is really precious for many of you, and you have given the time to us, so I really acknowledge you for that, so thank you. So this is the slide is around the COVID, what has been the trend in COVID. So as we all have heard in the media and everywhere, it's a national trend. The coronavirus cases are on the rise, and that's the same picture within Slough. Some population of some age groups are worse hit, and we look at those statistics much more. For example, the above 60 years, as we know from the first wave, the mortality and the deaths are higher age group. That's why we very closely monitor that age group. There is a concerning rise within that age group in Slough. So we've not had any deaths since the 2nd of October. We've had 2 deaths in that week due to COVID, but since then we haven't had, but there is an increase in the cases. And also what we look at is the data from the hospital around how many of the patients who have been admitted due to COVID-like symptoms or have been tested positive needs oxygen, oxygen plus, or ventilators, because that tells us how the cases are getting worse in terms of really monitoring the risks. The Slough COVID rate now is over 160. Actually, it's over 180 now since the slides have been made. And as I'm saying these figures, you might already in your mind be thinking, oh, that's increasing quite exponentially. So the rate of the increase is quite high. So when we look at the trends, the graph, it kind of puts up like a mountain, and it is more like a national trend rather than any southeast trend. Hence, Slough is the only local authority in the Berkshire which is in tier 2. The current trends of the new cases is representative of the overall demography. So, for example, it's evident when there is a certain in a certain community, the cases tick up in that community, and hence it's very important for all of us to be talking to a community about the importance of keeping those guidance in places so that we are all safe, and also protect the elderly in a community. Slough has got a number of multi-generational household. As little as few months old is living with grandparents or great-grandparents, and the risk is not so much in children and the middle age group, because they tend to recover faster and often, but it is when they transmit it to the older people in their loved ones in the household, that's when the really risky. Next slide, please. So as you probably have heard, that government has recently made 3 tiers. So tier 1 is medium, tier 2 is the high, and tier 3 is very high. Most of the local authorities or areas within UK started with tier 1, which is the medium risk, because the COVID cases are are high as compared to the summer. So we're coming to the winters, we were expecting the second wave. But Slough has recently been ticked to tier 2. The things that they got the cases, but also how fast the cases are rising, what age groups are these cases in. So if there are more elderly cases, then we are on the higher risk side. How many tests are being done in the community? And we are very lucky in Slough to have Montum site as the testing site very close to us. And also looks at how many of those tests have been tested positive. So looking at the percentage of positive tests in that cohort of the testings. So we're on the high. What it means is that that indoors. So I think it's repeats in the next slide. Next slide, please. So what the new rules means is that indoors there should be no socializing with other people. So other people means the household, people who you do not live with. So it doesn't mean the uncles and the aunties who live next door. It just means the person who lives in the same address. And that's something that's really important to read. And also, if you have got a support bubble, that is allowed. So if there was a single person who is within the support bubble, then you can still socialize with them indoor. Now, this is really important because most of the 30 to 40% of the cases in Slough are in the household bubbles. So what it means is that more than one person or two person in one household has been tested positive. In some cases, there have been up to 4 to 6 cases where individual household have got positive results. So it's really important to within the household have a plan. If somebody, for example, an adult is tested positive, how would they socially isolate within the household? So that's really important. So for example, if available, the toilets could be separate, use of the different towels, for example, beddings, etc. So that's one thing. But the other really important thing is no socializing with any other person indoors. The transmission is becomes higher indoors as compared to the outdoors, and that's the rationale behind it. Socializing outdoors is fine, but again, in the group of no more than 6. Now, this rule sometimes gets skewed because what people do is if they are a group of four, for example, then they call another family 2 people, and then that makes 6, and then the next day it's another 2 person that makes 6. So they're still following the rule, but what it essentially means is that if you've got virus from one person who you mingled with today, you're more likely to then start giving out those to other people who you haven't mingled before. So it's really important that you actually market who is your bubble and who you will be socializing with even outdoors. Again, that's all maintaining the social distancing. Continue working from home wherever possible, and also avoid travel wherever possible, so essential travels. Again, reiterating the message of hand, face, and washing hands, wearing a face covering, and maintaining social distancing. But also what is really important is the test and trace. As soon as somebody feels is symptomatic, threshold of the symptoms to be really low, as soon as they've got temperature or a consistent cough, then they should get themselves immediately tested. There had been some issues with the testing, but it has all been resolved. We've got high capacity within Montum. Actually, the capacity is much more. We are not getting as many tests done. So just to let all of you know that if somebody went on the .gov website to get the test, then they're getting normally the test on the same day. The availability is on the same day. We're also looking at putting some of the MTUs. So MTU's full form is mobile testing unit. So wherever we think that there is hotspot or people are not from that area traveling to Montum to get tested, we usually put those there. So you might on certain occasion get another venue within and those are MTUs. Isolate when symptomatic. Again, like I said, it's very important that we avoid giving the virus to another person, and that starts with self-isolating as soon as you're symptomatic. If you're tested positive, get test ASAP, and then if you are waiting for the test results, you have to continue self-isolating. Once the test is positive, then you continue the self-isolation, or if you are contacted as a contact of a case by the NHS Test and Trace, you should self-isolate. The role of the champion here is really important because the new tier 2 restriction actually means that some people get really confused with what it means. I have got loads of friends in Slough, and then they keep saying, oh, we are in a lockdown, or we are not able to go out and do our usual shopping, or we are shielding now, are we shielding now? So I think there is a lot of confusion in what the tier 2 actually means. So it's really important that you understand these rules and then communicate and clarify with the community. So again, these are the posters for the important messages. We, as a champion, again, the basic 3 rules that reduces any transmission, and these are very easy to do actually, is wash hands regularly. Where washing hands is not possible, then use hand sanitizers. Again, it should be made as a behavior and a routine that you wash hands when you come inside the whole house, and also when you're out and about, and you can wash hands. Use of the face covering to avoid any transmission, also maintaining the appropriate social distancing outside. Next slide, please. So this is the COVID dashboard. One of the things that we have been really working on is about the transparency. How do we make sure that the community knows what the data is? Now, there is a .gov website which has got the similar sort of data, but not many people usually start Googling or are aware of that site. So this is a Berkshire-wide site, which is still in the beta version, but you can still test it by clicking the website as given on the top of the slides. Hopefully the slides will be shared with you at the end of this day. And it tells you the cases. So for example, you can see in the Berkshire map, the dark blue is Slough. The daily new cases, it gives you how many cases were done on the 25th, for example. Now, bear in mind, if you see the data, the last 4 days data is always incomplete. And that is for the fact that the testing sometimes takes longer, or the test results take longer to come back. So that is why you have to view the last 4 days with caution. The daily, and then it also has got a tab around the deaths, so it will give you any total deaths and also death per 100,000 population. So it is a tool out there. It's very interesting, and also what you can do is compare Slough to other local authorities within Berkshire. So if you've got somebody in Windsor Maidenhead, you can look at how they are performing as compared to us. I think that's all from me. Next slide. Just making sure that it is.
Yeah. So Vinita,
Lovely.
There have been some questions, and I'm going to paraphrase one or two of them before we move on. So one of the questions was that somebody heard from somebody that works at Wexham Park Hospital that they're underreporting the deaths, and actually that's because if they told the truth, people would be scared. Is that true or is that false?
It is false, and there can never be an underreporting of the death because it is quite sensitive and it does not involve an individual. It involves a group of processes that are in place to report that. There's a strict definition of what a COVID positive death will be classified as compared to not COVID deaths. So there have been deaths, but they have not been COVID related deaths. So if somebody was tested positive and they were on ventilator, it's quite a straightforward definition that they have died of COVID. But if somebody had been tested positive and then they have been fine, but after a certain period of time they have died, that is also sometimes classed as COVID related because due to COVID. So there is a number of definitions, so it is not overreported. So in short, false.
Okay. I've got another question from Bob from the University of Third Age, which is, can I travel to Windsor, he says, because Windsor's a tier 1, and if I do, what rules apply to me?
So anybody who lives in a tier 2, for example, Slough, has to maintain the same rules as tier 2 when they're traveling to tier 1. So you would still not be going and socializing with somebody in Windsor indoors. You can do it outdoors in the group of 6. So that's a thumb rule. So if you are in tier 1, you're tier 1. Sorry, if you're in tier 2, you're tier 2, even though you go to tier 1 place.
Thank you. I'm not sure you'll be able to answer this question, but if you can, that'd be good. Otherwise, we can bring it into our frequently asked questions, which we have on our website, OneSlough.org.uk. The question is, what's the procedure for reporting people? So you're saying, you know, different families can't meet at home. But what if somebody is blatantly, you know, flouting all the rules and regulations? What do you do? Where do you go to tell people? And what action will they take?
Sure. I mean, one of the things obviously we do not want to start in people being police. So it's about encouraging as a community champions. I think first point of rule will be that you act as that champion in the community and have those friendly conversation and encouraging conversation with the people in your community about following the rules. If you think the rules are not being followed and there is a CV19 notification email address or a coronavirus email address, which hopefully can be put in the FAQs, where if you have certain issues, then it can be highlighted. And we will see in terms of compliance, what we can see is sometimes we work very closely with the police colleagues. If there was, for example, some gatherings in some streets overnight, so we try to work with our colleagues in the police department to encourage, enforce the rules there.
And another question, Vinita, is when are people exempt from wearing a face mask? So
there is a law.
Yep, sorry.
Yeah, there is a list of the, sorry, Ramesh. There is a list of the exemption criteria for the face covering. So it's not the face mask. So these are face covering, and which might include a face mask. So I think probably the best bet. So if you were certain age group, you had certain health conditions, you're exempted. I probably think it would be a good idea to put it in the FAQs, the whole list.
And one more question. In terms of faith and places of worship, if they've got one hall or maybe, you know, different halls, how many people can meet in each hall at a time?
The capacity, yeah, so the capacity of the hall, so there is a guidance around places of worship. So our environmental health officers are very happy to support the places of worship in order to assess that. If you basically, the easy way is if you measure how much is inside, the way to find the capacity is by maintaining that social distancing of 2 meters ideally, or 1 meter if there are certain contingencies put in place. How many people can you accommodate with that rule possible? And also the indoor mingling is only the household, so it's not a group of 6 anymore. So if you were mingling, if you were coming in the place of worship at one time, it would be a household and then social distancing with other household, but there should be no socializing.
Okay. So I've got a couple more questions, but I'm going to take them later. So Dolly's asked a very interesting, which I think is 2, possibly 3 questions in there. I'm going to ask Vanita to look at that later, maybe sort of answer at the end, because it's a bit more not so straightforward. And somebody's asked about what does group A, B, and C mean, and I'm going to now invite Tim, all right, to say that. But thank you very much, Vanita. Hopefully you're going to be sticking around to the end of this meeting. You got some time? I'm here
till 11 o'clock, Ramesh, and I've got a meeting after that. But if any questions that arise for community champions, if they email, I'm happy to answer.
Thank you.
And it was a pleasure today coming and meeting all of you.
Thank you. Stay with us. So I'll pass it over to Tim.
Perfect. Thanks very much. Thanks, Vanita. So I'm just going to present, hopefully no more than about 10 minutes or so, on a couple of things. One is on a research survey piece of work that's been undertaken by the Berkshire Shared Public Health Team, which is a Berkshire-wide organisation that support all the public health teams in Slough. And they're doing a piece of work around social insights, and that's trying to get an understanding of people's attitudes towards COVID and some of the challenges that we face with different population groups, different segments of our population. So they've done a lot of research. They've used a lot of the national research that's come out around compliance with COVID, infection rates with COVID, and that's been based over the past sort of 7 months of the pandemic. So this is kind of drawing on the evidence that we've gathered over the past few months. And what they've done is they've highlighted that there's 2 distinct groups that either aren't fully compliant with all the different rules of COVID, or that have higher rates of infection from the virus. Those 2 groups, which I'm going to go into in more detail in another slide, but it's what's known as Group ABC, which is a group of different age groups, and Group D, which is our ethnic minority population in all ages. And I'm going to go into those 2 in a bit more detail in a second to give you an understanding of the actual segment of those groups. So the research has kind of shown, and this is kind of anecdotal research, that's shown that actually in the first group, this is a segment of people that believe that they're already immune to the virus. Oh, sorry, if everyone could just mute themselves, that would be great. Thank you, perfect. So the belief from the first group of people, which is known as ABC, is that they think that they're immune and actually they're not going to be impacted on from the virus. Group D, that's anecdotal information that's showing that actually people don't potentially understand the guidance, whether it's not in the right language or in the right format, and the messaging around the different household rules, bubble, what it means to be in a bubble, household mixing, all these different terminologies. And the general summary of this is that the key government messages, hands, face, space, the rule of 6, social distancing, they're not getting through to different population groups. And we need a different approach, a fresh approach to really engage with those people and hopefully use that information that we gather to bring down our infection rates. So next slide, please, James. So this, apologies, there's a lot of content on this slide. And sorry, Bob, I've just noticed your comment. I'm going to go into detail in a second on the group and what that actually means. So this is just a kind of, I suppose, a useful statement from WHO's regional director from Europe, basically summarising the fact that we are reaching that point of kind of what we call messaging fatigue and pandemic fatigue. People have, have sacrificed a huge amount so far in the pandemic, and we know that we are just approaching, our second wave, and it's the virus doesn't seem to be going anywhere. So we are going to be in this for the foreseeable future. And he summarises that actually there are other strategies that we need to take to get back on track and crucially with our communities at heart. That's both measuring public opinion, involving communities in discussion and part of that solution, whilst hoping that people can continue leading their lives, but reducing the risk while they do that. And we need to make sure that that's innovative and that we are working with people to be able to do that. And that's why I wanted to bring this to community champions. So moving on to the next slide. So just going down into a bit more detail into those two groups and some of the challenges that we face within those two groups. So ABC, which I mentioned earlier, which are the people that potentially feel that they have an immune mentality. This is a segment of British male, white or Caucasian men that are generally across 3 different age groups. That's basically 18 through to about 64. And that's a group that's a kind of ABC group. So what we need to work out is who are the influencers for them? Where do they go to for their news? What news are they getting? Is it fake news? Is it kind of myths about coronavirus? And why are the key messages of things like hands, face, space not resonating? And how can we get that to resonate with those groups? The second group, the group D, that's a group that maybe don't understand what one household means, or the details of how and when to isolate. Like I said, this is reflective of a specific segment within our Black, Asian, minority ethnic communities, and predominantly those that live in one household but have family members in nearby other households, where actually the terminology of household is very different than it would be for other groups. And as Vanita's just said, it's very specific. It's the people that you directly live with. So what we need to work out as part of this research is who do those groups listen to? How can we work with them to get them to understand the meaning of household and the meaning of a bubble and the rule of 6, etc. And why self-isolation is important and when people should self-isolate. So it's kind of that clarity of the rules and reaching those people with the right messages. So moving on to the next slide. So very quickly, so we need to look at, as part of this research, we're trying to understand where people go for their information, who are the influencers, what are the effective channels for communication. We've looked at various different channels already, but how can we reach them in different methods? And essentially, what is going to change their behaviour? So what we need to do is understand what's important and what's not important to them, and effectively we'll use this information to create a campaign over the coming months as we go into winter to hopefully try and reach people in a different way. So next slide. So we're nearly there with this part. So the elements of the campaign, the timeline of what exactly we're going to be doing. So we're going to be doing a survey. The Berkshire Shared Public Health team are launching a survey to gain the insights of those different groups. We'll then analyse that, turn that into key messages. We'll develop kind of a multi-channel, multilingual approach based on what we've learned, test it with different communities, and then start embedding those within those different communities to try and hopefully engage them with the key COVID messages. And effectively what we're trying to achieve at the end of it is behaviour change. It's encouraging that conscious action to encourage COVID, what we know as COVID compliance. Next slide. So this is the last slide on the research. So what's the call to action? What are we asking of community champions, and what do we want everyone here to be part of? So what we'd like is we want all of you to be involved in the survey. We want you to be able to share this with some of your networks, your community groups, your friends, your family. Encourage them to complete the survey. We really want to reach a representative sample of people to understand those challenges. We also want you to be able to help with things like getting people to understand the survey, so feeding back to us where there might be challenges, whether there's translation challenges, whether there's challenges with the messages. And then that will be used by the shared public health team to create that kind of campaign and material at the end of it. The survey will be open for about a week from the beginning of November. So that's next week. We think Monday or Tuesday that the survey is going to go live. So I'll provide further information in the next Champions email update, which is tomorrow, and at the beginning of next week to let you know that, yes, the survey's live. Let's get out there and start reaching those communities. Great. So penultimate slide for me, so move on to the next slide. So this one was just a reminder from the last Champions meeting. For those of you that weren't here, might have missed this. The council and various local partners have been pushing this new campaign called #FitToFightCovid. This is all part of our community preparedness work. So in other words, it's how we are hoping to protect some of our community going into winter, the second wave, and the future in terms of COVID. And that's getting people to understand the importance of moving more and being active, and the importance that it has on your immune system, the fact that actually being of a healthy weight can reduce your risk of coronavirus, but actually simply the nature of being active can have a very positive impact on your overall immune system and on your mental health. And obviously, as we get into winter, this becomes increasingly important. So I've put this up there just for all of you for your information. It would be great for you to carry on sharing these messages with the #FitToFightCovid, and I'll include a little bit more detail again in tomorrow's email, Community Champions email, for those of you to share. Great. So moving on, that's it from me. I'll leave that now with Ramesh for questions and feedback.
Tim, Syra M, right at the beginning, put some thoughts down to say that the NHS website has lots of free exercises written on there, which is really, really useful. Would you support people using that website as well?
Yeah, absolutely. And actually, the NHS has got a fantastic resource about people recovering from COVID. So I expect some of you have seen the news around what's called long COVID. So that's people that have had COVID, they've recovered from COVID, but then they've had other sort of, longer term health implications of the virus, whether it's shortness of breath or sickness or what have you. And the NHS has created a fantastic page about how you can get back into normal life after having had COVID. So one of the things that we've done on the Fit to Fight COVID page is put a link to that resource. And it gives some really useful hints and tips from the NHS about how you can start returning to normal after having had COVID. So yeah, absolutely.
Another statement was made, and I'll turn it into a question from Sanjay right at the beginning as well, and it might be for either Vanita or yourself, but COVID is having an impact on lots of other health issues. Is public health taking those things seriously? It's not all about COVID, it's the fact that COVID is having impact on other health issues. Vanita.
Absolutely. I think one of the things that has been highlighted with the COVID is the inequalities, not just with everything else, but also with people who've got comorbidities, for example, diabetes, hypertension, obesity, people who smoke. So one of the things that we are doing as part of our BAME project under the clinical work stream is looking at both prevention as well as the clinical intervention for people with more I say them comorbidities with other conditions apart from COVID. So for example, what the GPs are doing at the moment is they are doing something called as risk stratification. So as all the patients in the 16 GP practices in Slough, their records are being run. People who've got more comorbidities, who are likely to be at risk when they get COVID, are being screened, and these people will be proactively supported with oximeters. If they get symptomatic, would be given NHS health check. We will working with the NHS colleagues to reinstate their health checks after the COVID lockdown in a safe manner. So we are looking at them, but also parallelly, public health is on a regular basis supporting the community with the other things like the campaigns around Fit for COVID or exercising or Quit for COVID, which is smoking, quitting smoking during the COVID period.
Thank you. So it's not just about COVID, it's keeping all the other health things. It's very important. I noticed that we got one or two other people on the call here. Nazar, we talked about BAME very briefly. Nazar, can you just say briefly what kind of things you've been doing in Farnham Road and other places to support the BAME community and get the messages out?
I am grateful that Timothy is there, and I think indirectly endorsed all the work we have done. We have translated all the information in 5 different languages. We distribute out the place of worships, and when there was a problem on Farnham Road, we done a road show, like a fashion models were standing all around there, including councillors, and we distributed those leaflets, and they were very effective. We got involved local business community, and there was also in our fashion show, everybody they're holding the, I don't know if you can see it or not, but I don't think you can see it. I did send it to you, Ramesh, if you can show these people around here, and we're going to do it more. And while I'm here, I would like to take the opportunity to inform you a few more things. I did something else. Myself, my son, and my 11-year-old grandchildren, we went for test because I set it by example, as gentleman was saying who they follow, and I believe some people follow me. Everybody follow me except my wife. Just make it very clear, that one, because she is the boss in the house. See, Anita laughed on that. That's true. You are the boss in the house. Right. We went there and test carried out, and I must say NHS praise them. System is wonderful. It's working. Staff is very friendly, but a little bit frightened for my grandson, because although regimental type this way and this way and this way, and I'm very pleased to say all our results come within 62 hours, and they're all negative. And I told a lot of friends that I've been through. Some people, I'm sure you all know that, I got a not wrong idea, misunderstanding about it happening. And there are people around there, they always have some conspiracy theory. What I'm doing, what is our duty is to go and tell it's a real threat. It is not threat for only one, for me, the people around me, and that's what we're doing. And I like to thank Ramesh on this point, getting us all together, and we're all working. I assure you, we'll do our best under the leadership of Ramesh. Tell us what needs doing it, and what else I can say. That's it then. Flu jab. I had a flu jab because I don't think it's morally right you ask other people to do until you go through that. That's hypocrisy. I had flu jab. I didn't have flu. I didn't have anything else. So encouraging people of flu jab, encouraging people to go to test, talking to them in their different languages, talking to the lingo. Let me say one thing now for Tim's information. You can print something in Urdu. Everybody won't understand. It's different dialogue, people from Asian community. We're doing our best. Only thing we need, a lot of support, a lot of moral support, and a lot of appreciation of the people working around me. It's not me. It's a lot of people around me, and they listen to me. I thank them through this platform. Thank you very much.
Thank you, Nazar. So I'm going to focus a little bit on younger people. Now, there were a couple of statements and questions around that one. I'm going to read out Wendy's. The young in our community have said, if this COVID is such a big thing, how come they don't know about it? They don't know anybody that's got it. So it doesn't really exist. And before that, Chris has also kind of made something similar about the ABCs, that no message is really going to work. And if we want a message that works with those people that are ignoring it, the messages need to be a lot more clever. Is public health doing anything to create messages that are targeting those people in a way that will work with them?
Yeah, it's I'll answer that to start with, and if Anita want to jump in as well. I think I think we've highlighted a few challenges there, just from Wendy's point, with the whole people believing that COVID doesn't exist because they haven't been impacted on them themselves or their friends. It's challenging because we know that the communities that have been disproportionately impacted on, especially in terms of deaths, are generally older adults that. Those younger groups may not have had that similar issue, and it's the same with certain things like flu, measles, and it's our challenge when we talk about vaccination, especially, and we call it the survivor's bias. So it's people that you've not been impacted on it, you've been lucky, you have what we call survivor's bias, and it's a challenge that we all have to work on, is to work with those groups to say, actually, what would it take for you to think differently about this? And I think that's part of the survey work that we're doing, the research work we're doing, but also part of the reason we've now got this community champions project in Slough, is to really kind of try and listen to those communities and to get to really understand why are people believing that COVID doesn't exist, or why are we believing that it doesn't impact on specific groups. And we don't want to get to a position where they do end up losing a family member and then going, oh, actually, no, I do think it exists. So it is a real challenge, and it is one of the reasons that we're now in tier 2, because we need to ensure that people, especially the younger groups, are protecting the more vulnerable. And especially at the point there that I think Peter's just put in there about families living next door but being part of their whole household. That's one of the reasons that we're doing this piece of research, because it's getting people to understand what the terminology of household actually is, and bubble. And then also pointing out the point that someone raised earlier about enforcement. Well, we try not to go down the route of enforcement. It's all about community engagement and behaviour change. But come a time, if we do get to that point, the police are empowered to enforce COVID rules. Like Vanita says, we've got the council's team that are taking queries from residents and that are taking points from people about where there are challenges, and they do act on it. So it's about all of those interconnected parts and how they all work together to achieve the same outcome, essentially.
So Vanita, I'm going to ask you the question from Dolly, which kind of links back to this, and I'll read half of it out for you. We're saying, so Dolly said, we're saying that in Slough, we face greater risk because of Black and Asian population identified at higher risk and more multi-generational homes. So how does the virus know the difference between 2 households mixing as opposed to 150 households that children meet at schools? And people are not very clear about these kind of things. I wonder if you could just expand, Vanita, for us. Can't hear you.
Thank you. Can you hear me now?
Yes.
Yeah, so it's a very interesting question, actually. Really apt one when we're dealing with the behavior change in the community. We go about saying that BAME population is at much more higher risk. Now, the higher risk is not just the higher risk of getting the infection. It is about the higher risk of when you have the infection, what as a result of that infection or the COVID is the risks attached. So for example, the major and the ultimate risk is the mortality, is the death. And what we have seen is the BAME population is more at risk of mortalities. If you see in the wave 1, number of mortalities have been more in BAME population. The number of the doctors, the NHS staff who have been, who died were more from the BAME community. And there are few things to be unfolded here. The BAME, I mean, there is a whole lot of risk, there are a lot of evidence and research done around this subject, but pretty much few points which jump out is, first, the BAME population has got much more comorbidities. So I am from an Indian ethnicity, which means that I'm more likely to have heart condition. I'm more likely to be predisposed to diabetes. A, either because of my genes, B, because of my diet, C, because of my lifestyle. So that's something that we cannot run away from. And hence, when I would have COVID, I mean, just to let everyone know that I did have COVID in March, and I ended up in Luxembourg. So when we have COVID, we are more predisposed to have it severe as compared to other white counterparts. So that's one thing. So it's not that virus knows who can fight and who can't fight. So that's one thing. The other thing around the BAME community is that we are more predisposed to the certain professions that whenever there is a high increase in the transmission, the BAME population is there. So we are more likely to work in fields like NHS, in care homes, as taxi drivers, or in shops, which do not stop when there is a COVID. So during the lockdown, the BAME population was much more there in the forefront, giving those services, and hence more likely to be affected. So there's pretty much, I mean, I can tell you a number of reasons, but these two are like the ones that jump out.
Okay, thank you. So I've got one final, Dolly, Amberly.
Dr. Datta, that doesn't answer my question. So I'm a scientist myself, working for a vaccine manufacturer. So I am asking from a scientific perspective. You know, we're saying to people, don't mix between two households indoors at the moment for tier 2 guidance. But we're letting our children, 150 households of children, mix, and the virus doesn't discriminate, is what you're saying. So how is our public health guidance not changing to say, let's reduce the risk, especially when SAGE guidance is saying closing schools will reduce the R number by the greatest amount, by 0.2 to 0.5. Nothing else. Closing bars and restaurants only reduces it to 0.1 to 0.2. So SAGE guidance is saying schools are a great place for transmission. Kids are not dying, but they're taking the virus home. And in our homes in Slough, we have multi-generational BAME people, right? So given the higher risk in Slough, there is an absolute onus on Public Health England to advocate for blended teaching, to reduce the number of people in a school setting.
Sure, I think that's a different question. Sorry, I misjudged your question before. So yeah, that's absolutely spot on. So what happens is when a policy is made, this is something that there's public health and the pure public health guidance. So if I was asked whether this mingling in the school increases the spread, I would say yes, because any mingling would spread. So that's one thing. But when the policies are made in the government, they look at the public health risks, they look at the economic risk, they look at the educational risk and the developmental risks. Being a mum of 2 children myself who attend school and being a public health person, it's quite a big conflict inside me when I see other parents not following this guidance and children going for play dates, and then my children are interacting with that. So totally take that on board. But when the policies are made at that national level or the local level now, with certain things, for example, whether in tier 3 the leisure centers would be open or not, whether the football courts would be open or not, and things like that, the policies are always made in a balance. So if the public health risk is there, but the economic risk is higher, then there's always a balance, which is not very ideal, because SAGE looks at the scientific fact, and which is not very ideal. And I know it's very frustrating for some people like you and me sometimes, but that's the guidance that we have to go with, unfortunately.
Thank you very, very much, Vanita. We're about 1 minute to the end. So I really want to thank everybody, for coming on to the call, and for our expert panelists, Vanita, for coming along and answering all these questions.